Okay, can you give us your name and your school?
My name is Margaret Phillips, and I'm at the University of Texas at Austin in the Biomedical Engineering PhD program.
And tell us a little bit about your research.
My research is focused on the oral delivery of protein drugs such as insulin, and the main focus of my work is to make hydrogels that are mucoadhesive to improve drug delivery and release in the small intestine, which will hopefully give us a longer time period for large protein drugs to be absorbed and enter the bloodstream, which should improve the oral bioavailability of protein drugs.
So tell us a little bit about the practical way this would work. What kind of patients would do it and why this is better than the current method?
So the patients that an oral protein delivery formulation would be used for are patients with type 1 diabetes who are completely dependent on insulin, also type 2 diabetics who have to take insulin injections. This technology could be used for calcitonin delivery for treatment of osteoporosis, as well as growth hormone for treatment of dwarfism, and interferon beta treatment for multiple sclerosis. And there's a few others also. And what we're aiming to do is to improve the lives of patients by reducing the need for injections by developing an oral formulation.
Okay, and I guess how would the patients currently get this drug, and why would this be better?
So protein drugs are typically administered by injection because they have a low stability in the GI tract. If you were just to eat insulin or another protein drug, your stomach, the enzymes in your stomach and the acidic conditions would likely break that protein down and render it inactive. And so what we're trying to do is give patients the another option for administration, because patients who have to take injections, it can be subcutaneous, but it can also be intramuscular. Intramuscular injections are extremely painful, and so we're really aiming to not only reduce that, but patients who have to take injections will oftentimes skip dosages because of the discomfort or kind of the added issues in taking care of a protein drug, which is typically refrigerated. They have to carry around needles, and they have to make sure to dispose of their sharp waste properly.
And so far, what do you think? What's the outlook on your research?
I think the research is very promising. Over the last 10 years, we've made great strides and have shown that we can make incremental improvements to the design of these hydrogel formulations. And so I think that that's good news in moving forward, that there is the option to engineer these systems to improve their efficacy. And so what we're really designing in our lab is kind of a multi-tiered approach in which we design the carrier to improve release of the drug and protection of the drug in the GI tract. But we're also doing things to improve its absorption, such as doing drug conjugates with carrier-mediated endocytosis so that the drug can be shuttled across the epithelium of the intestine to improve absorption into the bloodstream. So we're looking at several different avenues, and my work on the hydrogel carrier is just a small caveat of the project.
Great. Well, thank you very much.
Thank you.